Nigeria, Africa's most populated country. Blessed with abundant natural resources. It is amongst the world's leading producers of petroleum and home to one of its largest natural gas reserves. Yet, in this land of plenty, many Nigerians still suffer extreme poverty, and 70% live below the absolute poverty line. The country is ravaged by a host of health problems, including HIV, malaria, and diarrheal disorders. Clean drinking water is scarce. Good healthcare facilities are few and far between. A lack of qualified surgeons means that even simple operations like cataracts often cannot be performed in sufficient numbers. And with one of the highest maternal mortality rates in the world, Nigeria is now ranked 158 out of the 177 countries on the Human Development Index. Yet Nigeria possesses the ability to turn this grim picture around. The government's reforms and programs in healthcare delivery give confidence that Nigeria can indeed successfully implement such projects. And if Nigeria were to be successful in this movement, it could become a beacon of hope for the rest of Africa. This is the goal of the TCF Nigeria Foundation. TCF is a charitable trust established by the Nigeria family and like-minded donors. It addresses Nigeria's most vital healthcare issues and through its projects brings hope to hundreds of thousands.
The TCF Nigeria Foundation's approach has been demonstrated to deliver primary healthcare in Africa in a very effective manner. I personally believe that it's a fascinating model. What they've done is they've taken the best practices from business, such as clear objectives, measurable deliverables, transparency, accountability, and applied those practices to helping others and to philanthropy.
TCF has established a unique working model called Caring Capitalism, a philosophy where entrepreneurs work in collaboration with the professionals, establish partnerships with the government and the community to run projects which improve the welfare of the poor.
In Nigeria, TCF implements 3 projects: the Mission for Vision project, the Mission for Primary Health project, and the Mission for Water project.
We identified these 3 areas as the most critical change agents. Restoring sight, providing water, and ready access to primary health gives people a sense of control over their lives. With this control comes confidence, and from this confidence comes the ability to create a better future.
TCF's Mission for Vision eye care program is unique due to its reach and instant benefits, building on its sister foundation's experience in India, where in the last decade they have performed over 500,000 eye care operations. Treatment for the poor is free of charge, and already more than 17,000 people have been given the gift of sight. With the help of local governments and the community, outreach screening camps have been set up to identify patients in need of treatment and to arrange hospital appointments. At the hospital, each patient is given a full checkup before the simple operation is performed. Next day, the bandages are removed and the results are clear for all to see.
Na gode ma Allah, ina gani, kuma na gode muku, Allah ƙara muku ilimi.
As part of its program of expansion and commitment to sustainability and self-reliance, TCF has begun training local doctors and paramedical staff. These people represent the long-term future of the country's ophthalmic care. Through generous support from the Nigerian government and local communities, of equipment, infrastructure and staff, the Mission for Vision program has succeeded in changing the lives of literally thousands of people. And the cost? Just $60 per operation. Currently, TCF operates 4 eye hospitals: Birnin Kebbi in Kebbi State, Calabar in Cross River State, Owerri in Imo State, and Yola in Adamawa State. If under private-public partnerships, this can be expanded to a hospital in each of Nigeria's 36 states, then access to vital ophthalmic care for every Nigerian will become a reality, and curable blindness will become a thing of the past. Through its Mission for Primary Health project, TCF is providing essential frontline medical care, especially for mothers and children in deprived rural areas. Scarce and expensive medical facilities force rural women to trek many miles to access basic medicines, while not being sure about their genuineness. The project began with the aim of providing high-quality, affordable healthcare to the community right at their doorstep. Encouraged by its success, TCF now has 5 projects. The Eniosa project in Oyo, the Adana project in Osun, the Yola project in Adamawa, the Isu project in Imo, and the Kachia project in Kaduna State. The model for these projects is simple yet effective. At the grassroots level are health posts. These posts are established in outlying villages and provide immediate care for the surrounding population, serving about 2,500 people each. These health posts are grouped into clusters of 10, with each group overseen by one of the 3 or 4 health clinics, each located in a government facility. In turn, these health clinics are managed by the Primary Health Center in a government building. Already, the Mission for Primary Health program has delivered quality pre- and postnatal care for Nigeria. It has ensured the safe birth of thousands of children, seen significant reductions in maternal mortality, and dispenses genuine medicines.
I am very happy because of this hospital built in our community. It helps us in delivering, and they always take care of us, both we and our children. During deliverance, they look after us very, very well.
In the name of TCF Nigeria Foundation, it is purely a health revolution in the sense that it is targeted at the poor masses. It has made health not just affordable, but accessible to our people.
By training local people as caregivers and health workers, TCF is helping make the local community self-sufficient and actively laying the ground for a sustainable future. Supported and supervised by government staff in health clinics and primary healthcare centers, local health workers provide essential door-to-door, village-to-village services, ensuring that healthcare and education reaches the most needy. This means devastating diseases like HIV and AIDS are dealt with at the critical grassroots level. Having built the trust of the local community, TCF is now spearheading a successful campaign of awareness and prevention on this sensitive issue. By targeting reduction in infant mortality, improving maternal health, combating HIV, AIDS and malaria, TCF health programs address key Millennium Development Goals. By using existing government infrastructure and with community support, TCF has managed to control the cost for the delivery of this healthcare to a mere $2.25 per person per annum. If this cost-efficient, highly effective model can be replicated in each state, then a roadmap to provide quality healthcare to the rural poor will truly have been established.
Above all, I think TCF Nigeria Foundation in its primary healthcare sites has proven that it is possible to achieve Millennium Development Goals over a relatively short period and with modest means. And I believe this is very, very important for other health service delivery carers to take note of and see how this model can be replicated and further introduced.
TCF's Mission for Water project helps provide essential clean drinking water. Every day, millions of Nigerians face the reality of having to trek miles to gather water, most of which is unsafe to drink and contaminated with waterborne diseases. Ironically, thousands of bore wells and pumps have been sunk across the country. However, due to lack of maintenance, most remain inoperable. By repairing these boreholes and hand pumps, TCF provides an economic way to drastically transform the lives of rural communities.
Gada sai mun wahala ga ruwa gari yoji min jiro da kyan mu samu ruwan da mun ka sha mun kai wanka da roda da komai ta sha mun kai yanzu ko alhamdulillah ai muna honhu ya wadata shemu mun ji daɗi mun gode alhamdulillah.
In partnership with the government, which provides logistics, vehicles, spare parts, and the services of the local water board, Kebbi State alone has seen 305 non-functional boreholes successfully reactivated. While in Cross River State, the process has already begun with 45 wells rehabilitated across 8 local government areas. Once again, the model is a simple one: to reinstill the sense of ownership that is missing. The first step is to mobilize the community. Then, committees are formed at each hand pump, and local village workmen are trained to repair the pump. Finally, depots with tools and spare parts are created within easy access of the villagers. In this way, the community can help itself. Supervisors monitor the wells and help teach good water practices, such as preventive maintenance and sanitation. Fencing is built around the pump to keep animals at bay, and clothes are washed in separate areas to prevent pollution.
I want to commend the incredible work the Tulsi Chanrai Foundation has been doing here in Cross River State, in the provision of water to communities who hitherto had none, and sight to people who were without hope of ever seeing in their lives. The work has been of tremendous impact to the people of this state, and I hope that we can grow our cooperation from strength to strength.
Through the success of its by the people, for the people concept of maintenance, TCF is able to target a 95% functionality rate of water pumps against the current national average of just 50%. The cost of reactivating a non-functioning borewell is just $300, a tenth of what it would cost to drill a brand new borehole. With each pump serving an average of 600 people, TCF's Mission for Water project delivers clean drinking water for as little as 50 cents per person. TCF aims to set up similar water projects in each state. In addition to meeting a key Millennium Development Goal, the provision of safe drinking water addresses 50% of basic health problems.
Efficiency, simplicity, and cost-effectiveness form the backbone for TCF's successes. The projects serve as well-established models that are sustainable and can be replicated throughout the country.
These projects are true examples of public and private partnership.
What they are doing, they're probably covering about 200,000 people right now. But it's a good beginning, because if we have other partners to do exactly what they are doing, we can replicate what they are doing, and if other partners join, then it will strengthen the public-private partnership policy that we are adopting in Nigeria. And in that case, it will be a way of liberating, Nigerians out of poverty.
TCF has proved that well-conceived, well-managed projects can irrevocably change lives. However, the Foundation's goal of bringing health and prosperity to each and every Nigerian home is far from complete. Millions still await deliverance.
It has been my privilege to be involved in all TCF projects right from the beginning. Fortunately, I have traveled across the country and met the people at the grassroots level who have benefited and participated in our projects. I would like to thank all levels of government, the communities, and the donors, without whose support these projects would not have been a reality. I am now totally convinced that these projects can be upscaled to every state of Nigeria. We have no time to waste. We must act now.
While we have come this far, we still have a long way to go. 25,000 water pumps to be rehabilitated, 32 more eye hospitals to be set up, 31 more states require primary health care. Please join us in this movement. Let us together make a difference. We will rest only when every Nigerian can drink water without fear of disease. We will rest only when every village in Nigeria can access primary health care. We will rest only when curable blindness is no longer denying people their right to dream and hope.